Good morning, Coleman. I'm Antonio Cipollaro with My Coleman Television. I'm here with Dr. Mark Christensen with Coleman Regional Medical Center. Now, Dr. Christensen, what is BrainScope?
Well, I'm here to tell you about BrainScope. It's a new technology that we're using at Coleman Regional in the emergency department to look for brain bleeds and concussions in head-injured patients.
So what makes BrainScope different from like a CT scan?
Well, prior to this device, there's been no real way to tell if somebody's had a concussion, and the only way to tell if they have a brain bleed is through a CAT scan. But that can expose people to sometimes unnecessary radiation, can take a little bit longer, and we were looking for a tool that could also tell us about concussions. And so we found that with this technology.
Now, I heard Coleman Regional is the first hospital in the Southeast to use this technology.
We are, and that's pretty big news, and we're excited about that. You know, we were looking for technology to really improve medical care that we're giving in the ER, and this is it for head-injured patients. We're excited about it.
Okay.
Yeah.
Why did Coleman Regional implement BrainScope?
Well, like I said, a lot of patients would come to us with sports injuries, work injuries, things like that, and we would tell them, yeah, there's no bleed, but you may have a concussion. There's no real way to know that. With this device, we can tell them how bad their concussion is, and we can get them appropriate follow-up care with local neurologists to continue their concussion care.
How does BrainScope benefit patients?
Sure. Well, we found that most patients that come to the emergency department with head injuries have a really low risk of having something internally wrong on CAT scan. So about 90% of patients get radiated for 10% to have caught something. So with this device, we can tell within a matter of 3 minutes if somebody's likely to have a brain bleed or a concussion.
Okay.
Premier Bank of the South currently offers a variety of School Spirit debit cards. These are available to all of our customers and they're free of charge. Stop by one of our offices today and get yours ordered. For a listing of our School Spirit debit cards and our office locations, please feel free to visit us at www.premierbankofthesouth.com.
People say watching paint dry is boring. But some of you know paint can bring a wall to life. Because you are particular. Particular helps you find the perfect color and nail the details. So be proudly particular with paint like no other. Benjamin Moore, the standard for paint professionals. Find Benjamin Moore Premium Paint, available now from your local paint experts at O.F. Richter & Sons.
At the Palmer Law Firm, from the moment you arrive at our office, you will feel a sense of comfort. We understand you are experiencing multiple emotions, such as fear, uncertainty, and confusion. At the Palmer Law Firm, it is our goal to provide an environment in which you can feel comfortable and leave knowing you have come to the right place. Tanya handles estate planning, real estate law, family law, and can help you with any situation, big or small. Come by the Palmer Law Firm or give us a call at 256-246-9600.
How was BrainScope helped improve the quality of care of patients with head injuries?
Yeah, we found already since using this at Coleman Regional that BrainScope has helped us reduce our unnecessary CAT scans by about 30%, and we've reduced our total length of stay in the emergency department for head injured patients by about half. So it's pretty incredible.
Now I see you have the instrument here with us today.
I do. So it's a pretty straightforward device. These are some electrodes that temporarily get placed with sticky pads onto the patient's head, just like that. We prep it, and then this device analyzes their brain waves. It's an EEG, but it uses artificial intelligence, AI, and it matches their brainwave information with other age and gender matched norms to tell, is there the chance of up to 1 cc of blood in the brain and how bad their concussion is. So
and it's I see it's portable.
It's portable. This was tested on the battlefields. This was cleared by the military first, and now it's FDA cleared for use in hospitals and emergency rooms. So the patient can even hold this and run the test there. They just relax for about 3 minutes, close their eyes, relax. This detects their brain waves, and again, can look for the smallest amount of blood in the brain, and also tell us about a concussion and how bad that is too. So it's pretty neat technology.
That's pretty cool, ladies and gentlemen. Look at that. Yep. So I'm here with Mark Christensen, Dr. Mark Christensen. This is, I'm Antonio Cipollari, and this is, I guess, Tony Talks.
Thanks for having me.
Thanks for coming on the show.
Yep.